Yes, you can proceed.
Okay. Now I would like to request Dr. Nazmul Shetu. His topic is head neck tunneling in Perthes disease. Dr. Shetu.
Do you hear me?
Yes, sir, we can hear you.
Dr. Shetu, please share your screen.
Yes, we can see your screen.
Okay, we can see you.
To the screen.
Yes, sir. We can see
Yes, please continue, sir. Slideshow.
See, Chinese are disconnected.
Thank you, Dr. Arif, for arranging this program. And thanks to my mentor, Professor Bari. May I start now?
Yes,
Femoral tunneling and arthrodiastasis of hip joint by Ilizarov fixator for the treatment of leg cuff Perthes disease. Introduction. Leg cuff Perthes disease is a common orthopedic problem, usually affects 4 to 9 years of age group. Treatment of LCPD is still now challenging for orthopedic surgeons. Different surgical and non-surgical treatment of
No screen.
Yes.
No screen.
Yes, sir. We can see his screen, sir.
Yes.
Dr.
No
Shetu, please
screen.
continue.
Okay. The leg cuff Perthes disease is a common orthopedic problem, usually affects in 4 to 9 years of age group. Treatment of LCPD is still now challenging for orthopedic surgeons. Different surgical and non-surgical treatment options applied for LCPD, but none of them are satisfied up to the mark. Ilizarov method for the treatment of LCPD may become better option in our country. The aseptic osteonecrosis of femoral head in children is called leg cuff Perthes disease. Leg described as trauma as a possible factor. Carl thought it was due to altered osteogenesis. Perthes suggested that an inflammatory process could change the shape of the femoral head epiphysis. In 1963, it was named and established as leg cuff Perthes disease. Basic goals of the treatment: to eliminate hip pain, to restore and maintain a good range of hip movement, to prevent femoral head extrusion and subluxation, to obtain a femoral head as spherical as possible. Ultimately, to prevent degenerative change of the hip in later life. Why naked tunneling and arthrodiastasis? Gamal Hosni mentioned that joint distraction attempts to neutralize muscular and weight-bearing forces on the femoral epiphysis, induces neovascularization and prevents head formation. According to Pele, cartilage in LCPD is very bioactive and tends to proliferate in unloaded regions of the hip joint, and destruction obtained with external fixator takes the load off the femoral head, creating a space for the proliferation of the cartilage and shaping itself to the acetabular cavity. Aims of the study: to see the ultimate outcome of the LCPD. Method: number of patients 5, affected head femur, left 4, right 1, age group patient 6 to 9 years, and time 2019 to 2021. Diagnosis: all are diagnosed by clinical examination and X-ray, no MRI or CT scan. Clinical examination mainly phenoromer test, Thomas test, and roll test. Hip movement, that is Faber test. Most commonly used classification system is Herring classification. Within first 6 months of clinical symptom, it is in the early fragmentation stage, it can be applied. To the classification, that is 3 pillar, lateral, central, and median. And group A, 100% lateral pillar is maintained, and group B, more than 50% lateral pillar maintained, and group BC, broad, tall, and narrow type is shown with slightly more than 50% lateral pillar height maintained on narrow base. Group C, that is less than 50% of the lateral pillar height is maintained. And that is in a nutshell. Group A, no involvement. Group B, more than 50, over 50%. And Group BC, 50% loss of height, and group C collapse and loss more than 50% of the lateral pillar height. Procedure, we do not go through the details. Just have a look to the frame construction. And this is the frame construction, medial and lateral surface, and follow-up. Follow-up is very much important. Without good follow-up, result will be jeopardized. Keeping the frame for next 6 to 8 weeks with meticulous follow-up at 7th day, 15th day, 13th day, 42nd day, and so on. After removal of Ilizarov fixator, hip spica cast or bilateral hip abduction brace set at 30 degrees. Abduction per leg is applied for day and night for 6 weeks. After that, full weight-bearing movement is allowed, but brace is only at night for the next 6 months. Allowed and not allowed. That is, swimming, cycling, and walking are allowed. Running, jumping, and participation in sports are not allowed for 1 year after treatment. PLA practice exercise, that is wide abduction standing, supine hip flexion, prone internal rotation stresses, prone external rotation stresses, prone hyperextension of the hip joint. Case illustration, you can see Jiayu 8 years and type group C, and after the frame construction and after 4 weeks, you can see the changing of the femoral head. And after the frame removal, there is petricus with abduction, and after removal of the brace, that is hip is restoring. And Junai 7 years, left femoral head, group C, and that is after frame construction, after removal of the frame construction, and real 6 years, LCBD left femoral head, type BC 1, and after frame construction, after removal, you can see the before operation and after operation. And Huzaifa, 8 years of boy, left hip purchase, after application and after 4 months, and after removal of the frame, you can see, and you can see the slide. Just have a look. বসো দেখি, হ্যাঁ দাঁড়াও। আবার বসো।
জি স্যার, দেখা যাচ্ছে স্যার।
Very good. Okay. And this is another case, Mr. Raj, about 6 years, boy, and before operation and after operation, after removal of the frame. This picture is after 1 year. You can see almost nearly a normal hip regain, and this is the Raj, and he is, you can see. আবার যাও, হ্যাঁ ওই দেয়াল পর্যন্ত যাও, হ্যাঁ আসো, ঠিক আছে, এখানে বসো, দাঁড়াও, বসো, দাঁড়াও। Very good. Results. 2 cases of LCBD got the excellent result. 3 cases of LCBD radiology shows improving the head congruency, but clinically hip movement still limited. 1 case radiologically shows not satisfactory improvement of the head, but hip movement gradually regain without pain. Conclusion. Minimal invasive procedure after diastasis with naked tunneling by Ilizarov method might be an effective procedure for the treatment of LCBD. It maintains anatomy of the hip joint after diastasis. The Ilizarov method provides a way to bypass loading forces of the joint, which negates the harmful effects of stress on articular surface, thereby promoting healing of the areas of necrosis. Limitations: very small sample, follow-up period is very short. Sometimes patient cannot get the proper physiotherapy. We are the Kurgan fellow, you can see here, and thank you.
Thank you, Dr. Shetu, for your nice presentation. Please screen share off.